Greetings, everyone. My name is Tracy Miguel, and I'm currently a first year occupational therapy student. And today, we are to discuss healthcare body system awareness and indicate background study about the body systems. The focal point of this is to disseminate information for our future healthcare practitioners, as well as those folks who may find themselves involved in the scope. This would also aid us in becoming more prepared and conscious individuals in the long run, especially when our valued health is on the line. You could present the three main points which focuses on three significant organ systems, namely the cardiovascular system, the respiratory system, and the urinary system. The main objectives are as follows. Determine the roles of occupational and physical therapists in each body system. To be aware of the relevance of studying each topic for occupational and physical therapy students. And lastly, to come to the apprehension on how studying these body systems will assist future healthcare providers. Through this opportunity, we want to instill this understanding to our viewers and enlighten people of topics concerning our healthcare. With that, we would like to encourage all of you to listen carefully as we share ideas and valuable information. Now, for the opening remarks, allow me to introduce you to Mr. Magazo.
Thank you for that wonderful introduction, Ms. Miguel. Let me introduce myself. I'm Jonathan Magalso, currently a first year PT student, and I'm going to define the first definition of those three body systems that we're about to further discuss later. First is the cardiovascular system. Cardiovascular system consists of the heart, veins, arteries, and capillaries, but there are three major parts of cardiovascular, and that is the heart, blood, and blood vessels. Cardiovascular is one of people needs without it will die instantly. Because cardiovascular helps with the blood flow in your body. Heart pumps the blood and other parts, especially veins, will circulate in your whole body and it carrying nutrients and oxygen tissues and removing carbon dioxide and other waste inside your body. Second one is the respiratory system. Respiratory system helps with our breathing and cleans waste gases that comes on our body and straight on our blood. And one of them is carbon dioxide. Respiratory system parts are including nose, mouth, throat, and lungs. Nose and mouth are the main entrance of air. These help us to inhale and exhale air throughout our body. The third one is the urinary system. Urinary system deals with the filtration of our blood and it creates urine for our waste excreted on our body. Urinary system helps with removing waste product of medicines, balance of variety of electrolytes, release hormones to control blood pressure and red blood cells. Urinary system major parts are the following: kidneys, renal pelvis, bladder, and urethra. That would cover all my presentation. Without a further ado, let's hear out Ms. Manalo, Mr. Hasmin, and Ms. Mauricio while they're sharing their insight about the role of an OT and PT. In this three system, the relevance of studying it and the benefits that they can possibly obtain in studying it.
Good day, my name is Jana Alisa A. Manalo. I'm a first year PT student and I'm here to share my insights for you to gain more knowledge. First of all, let me give you a simple description about the types of being physical therapists. We all know that being physical therapist doesn't stop from the injury, dislocation of bones, rehabilitations. There are many different specialties in physical therapy such as neurologic physical therapists, pediatric physical therapists, or acute care physical therapists, etc. And to answer the first question, what are the roles of PT in this body system? I'll explain the role of PT briefly and precise. We have this specialty that called cardiovascular and pulmonary PT. They are the one who helps the patients to improve their cardiovascular health and aerobic capacity. They are also the ones who help the patients to improve their breathing, to build endurance and strength, because we all know that being PT helps the people to go back in a life that they used to be, because people or the patients can do daily living activities if they are struggling, right? Now let's proceed for another question. What are the relevance of studying these body systems? I think all the med student must know everything about a certain body system, because as a PT student, we need to know what are the function, the parts of the body, even the flow of the blood, we must know it. because we can risk the patient's life, and even a little mistake can risk the patient's life. We need this to understand what is the procedure or how the procedure works, how to evaluate the patient, and what is the treatment for a certain disorder, since all we do will affect the patient and we should know how the body works. And by studying cardiorespiratory and urinary system, we're going to be a intellect professionals when it comes in curing patients from suffering heart failure, lung failure, or asthma, or even in urinary infection. And to answer the last question, how does this body system will help me in the near future when I became a PTRP? I may encounter a patient that have condition in its heart or in respiratory or even in urinary tract. And if I encounter that kind of patient, I already know what to do or what I won't do. Though as a doctor, we really need to monitor this part of the patient, such as the vital signs. We must know how to read it. We must know how to do it, because this is one the important thing in being a doctor. Because every procedure we must get the vital signs of the patient. Or maybe someday I want to be a cardiovascular and pulmonary physical therapist, and if I do that, I already know how to help them and how to teach them the more effective breathing technique. Now that's the end of my part for this report. Thank you for listening. Now let's proceed for our next reporter, Mr. Hasmin.
And thank you for that meaningful presentation, Ms. Manalo. Hello, everyone. I'm so glad you can join me today, and it's a pleasure for me to introduce myself to you. I'm Andreas Min, and I'm a first year OT student. I would also like to add more information and my insights about this topic. To make that happen, I will answer the three questions with my own perceptions. But first, let's discuss about the role of an OT in the cardiovascular system. As occupational therapists, we have the duty of providing assistance to clients who are going through diseases or have a disability with regards to their cardiovascular system. First, starting with assessing the cause of said disease or disability. We should first understand the client's physical condition and mental condition after having gone through said disease or disability. Then after doing so, we should consult with them, how they are dealing with their disability or disease, psychologically, and how it affects them in their everyday life. If they are still motivated to get better and if they plan to get better, even if they are undergoing the recovery from this said disability or disease. Up next, we should provide our advice with regards to preventing their condition from getting worse by setting up a prep plan with the food they consume and doing some workouts that will prevent their condition from getting worse and help improve their condition so that they can get back into working condition. After setting up a proper course of plan for improving both their physical condition and mental condition, we need to set up their goals throughout undergoing this OT session. We need to do this with the client being at the forefront of setting up what they plan to achieve out of this session. Simply because if they are not the ones motivated to achieve goals to improve their condition, it will become pointless. It could even set them back if they see no results or improvements because they did the sessions half-heartedly. Only when they give it their all and they have the desire to get better that they will see improvements. So the desire to set a goal needs to come from the clients themselves. Lastly, we OTs are obligated to do our sessions with the intention of getting our clients back to working condition. So we need to center our sessions where the clients previously spent most of their time doing, which is through their occupations. The relevance of learning all about the cardiovascular system is for us OT students to have a better grasp of the various parts of the cardiovascular system. Learn about what makes up the cardiovascular system, the parts of the heart, the circulation of deoxygenated blood and oxygenated blood, and how they are distributed from where they originated from. The purpose of studying the cardiovascular system is for OTs to have the set of knowledge and skills required to deal with patients that have gone or clients that have gone through cardiovascular system diseases and disabilities, such as coronary heart disease or stroke. This knowledge and set of skills that we learn and develop by studying the cardiovascular system will allow us to provide the most appropriate intervention plan for clients that are inflicted with cardiovascular system diseases and disabilities. The next body system that I'm going to discuss is the role of an OT in the respiratory system. Being occupational therapists, in order for our clients who have problems and difficulties with the respiratory system, like having chronic respiratory diseases, or we are tasked with making sure that we can set the proper intervention plan to help our clients perform their daily activities in daily living as normally as possible. Starting off with assessing the cause of their said illness or disability. We need to understand if it is because of their physical condition that they have had or contracted since they were kids, or if it's something that they only noticed or picked up late in their adulthood. We also need to check in with them with how disability or this disease is affecting their mental health, so we can have a better idea as to how they are dealing with the situation themselves. After assessing the situation, we can now provide and come up with a plan to get them to working condition as soon as possible. But we can only get to that if the clients themselves are motivated enough to get themselves better. They need to be the ones to set up what their goal is and what they are trying to achieve from going through an OT session to help with their disability. Then once we and the clients have a goal in mind, we can then tackle the factors that affected the client's health by providing them better meal plans that affect or give them more energy throughout the day, and setting up a training plan that will fit with their physical capabilities in order to not push their bodies to exhaustion while still having improvements with their stamina and overall physical condition. Once we have a set up plan to improve their physical and mental capabilities, we can then implement these into their occupation in order for them to not only improve their and prevent their condition from getting worse, but also getting their body and mind ready and more acquainted with coming back to the client's occupation, like at work or being a student at school. We are required to study and learn all about the respiratory system in order for us to know the ins and outs of this said system, the different parts that make up the respiratory system, and how we swallow food and how we intake air, all in order to have a better understanding of how our respiratory system functions. These valuable knowledge that we can gain and these sets of skills that we can hone through years of experience are all important factors that we can use to encounter when we encounter clients with respiratory system diseases or disabilities, such as asthma or lung cancer. In order for us to provide ways and interventions that will allow clients with asthma to be able to do their activities in daily living, such as going to school or playing around at the park, and making sure that clients gain the confidence back to know that they can still perform their occupations despite their disabilities, like being exhausted easily because of their stamina. The last part of this report is my insight about the role of an OT in their urinary system. With clients that have issues and disabilities with their urinary system, we as OTs do our best in order for our clients to be able to perform their activities in daily living, even with the disability that they are dealing with. First, we must assess what are the issues that they have with regards to their physical condition and mental condition that is being affected by their urinary system disability, like bladder issues. After a thorough assessment, we then integrate the use of tools or assistive devices to help our clients deal with their bladder issues more conveniently. Like with elders dealing with bladder issues, we provide them with a tool that they can use to urinate without having to move around the house multiple times, like using a diaper for adults, and even providing modification to the client's bathroom for easier and safer use without needing any assistance. With the urinary system, the knowledge and info that we can learn and gather is vital to improving our outlook with understanding how the urinary system functions. Like understanding that the kidney is where our blood is cleaned and toxins or wastes are separated from, and that this is how our urine is formed, which is the mixture of separated toxins and wastes alongside water, providing us a way to release these toxins in the form of urine, and having knowledge and about these parts and how and why they function. These are tools that will become useful for us in the future as occupational therapists. These studies and knowledge that we learn about the urinary system will be useful when we have clients dealing with urinary system diseases like bladder issues, as we can provide an intervention plan to our clients that will give them convenience with dealing with their bladder issues, allow them to integrate themselves again with society, and go back to their occupation despite their disability. that they are dealing with their urinary system disease. So that's the overall structure of my presentation. Let's move on now to the next reporter, Miss Mauricia.
Thank you, Mr. Hasmin. So, going forward, I am Maria Regina Mauricio. I'm also a first-year OT student, and I'm about to discuss my insights about the corresponding body system that was assigned to us. Let me give you a brief explanation first about OT practitioners. An occupational therapist is rehab specialist that uses occupations and interventions for individuals that has experienced a decline in functional ability. Okay, going forward to the main agenda of this reporting, I'll share my insights now about the role of an OT in cardiovascular system. For an occupational therapist, patients with heart failure are becoming a part of the everyday patient population in the acute care, subacute rehab, inpatient rehab, home health, and outpatient settings. An OT would be a relevant part of this matter because the occupational therapist would be the one to conduct a throughout evaluation of the patient's physical and psychological functioning while also seeking to understand the social supports they have in the hospital, home, or community. From this initial evaluation, occupational therapists can work with the care team in the cardiac rehabilitation program to create individualized treatment plans for patients to address their specific needs. The OT can then give advice to the patients on the best ways to return to work after suffering a cardiovascular condition and even work collaboratively with employers to plan the patient's return to work. And for me, this could be a lot of help to maximize all my potentials as an OTRP in the near future. Learning how to function and limitations in physical capabilities, it with the psychological duress that often accompanies cardiovascular disease is a gradual process that takes deliberate effort. The second one is my insights about the role of an OT in respiratory system. Occupational therapy is an area of mystery to many health professionals. Apart from assessing homes for fall risk, they can help patients with chronic diseases in a variety of ways. For example, occupational therapists can help manage COPD by teaching methods and providing devices to undertake showing, dressing, etc. Next is teaching proper breathing techniques while performing daily activities to help with shortness of breath. Next is teaching ways of saving energy and simplifying a task so people have the energy to do what they enjoy. Next is improving upper limb strength through exercise training. And lastly, teaching ways to relax and manage stress. Many occupational therapists will also use deep breathing techniques like diaphragmatic breathing to assist in their goal of creating the highest level of independence possible for their lives. With this type of patient who's suffering from respiratory diseases, we could possibly obtain new knowledge about management of respiratory disease. This will set realistic and achievable goals with you to work on as part of the program and make recommendations for the future to encourage you to continue to manage your respiratory condition and maintain your quality of life upon discharge. Lastly is my insights about the role of an OT in urinary system. The more comfortable a therapist it is in addressing pelvic floor issues, the easier it is for the patient to open up and feel confident in sharing about these personal issues. One of the best head start for an OT is starting the conversation is key to successful integration into the OT treatment plan. Here are some of examples on how to ask patients about their incontinence while also reduce feelings of embarrassment and awkwardness. First, do you ever have a hard time making it to the bathroom on time? Next, when you laugh, cough, or stand up, do you ever experience leakage? Next, When you need to use the bathroom, do you ever experience a very strong urge that makes you feel like you need to rush? Occupational therapists are concerned with an individual's functional ability to carry out the occupations and daily activities of life. Given that going to the toilet and endeavoring to remain continent is an everyday activity, it would seem that continence care is an area which many OTs could richly contribute. OT professional will not only learn how to integrate urinary bladder issues into evaluations, but also learn practical tips from treatment in the home health settings. OTs can give advance their clinical outcomes and truly help clients improve their quality of life through these interventions. Thank you. That's the end of my presentation.
Before ending this presentation, I would like to give thanks to all the reporters who spoke and presented today, and most importantly, to those people who lend their time to listen. Thank you all for your participation in today's webinar. It has been our goal to pass on this information and spread awareness to the public so that each and every one of us will be knowledgeable on the crucial role our body systems play in our everyday lives. And just like how significant these systems are, taking good care of them should be one of our priorities. Always remember that our body systems work together to serve a common purpose: growth, reproduction, and survival. We must learn to pay attention to all the possible risks that may affect one of our body systems for us to improve our chances of survival by maintaining a stable internal body environment. That's all today, everyone. Thank you, and always stay safe.